صباح الخير جميعا. Our lecture today is talk about wrist-carpal instability, presented by me, Sarah Uday. What do you want regarding wrist analysis to assess if the wrist is stable or not? Start with positioning. Is it proper or not? The joint spaces. Look for parallelism and symmetry. And the carpal arches. Assess if there is any disruption. Indicate fracture or ligament tear. And also the shape of carpal bones, especially the lunate and scaphoid bone. And the axis of carpal bones, whether normal or dorsal instability or volar instability. Start with positioning. On PA view should be taken with the wrist and elbow at shoulder height. Only in this position, the radius and ulna are parallel, and moving the arm down make the radius cross the ulna and become relatively shorter. So it will be impossible to make any statement on the length of ulna plus or minus variant. Lateral view is taken with the elbow adducted to the side. Shoulder, elbow, and wrist are again in one plane. This positioning will make the lateral view exactly perpendicular to PA view. As we seen here, the PA view and the lateral view. PA view, correctly positioned PA view, will show the extensor carpi ulnaris groove radial to the mid portion of ulnar styloid. As we seen here, this is the yellow arrow. The extensor carpi ulnaris groove. The PA and the lateral view are equally important and thus should both be studied carefully. The PA view usually show what is wrong and the lateral view show in what direction the bone move. Sometime oblique view will also be obtained, especially if you want to look at the trapezoid joint in profile. The lateral view, only on good positioned lateral view, one can see the volar edge of respectively scaphoid, pisiform, and capitate separately and line up as shown on the picture. This is the lateral view and show the volar aspect of pisiform and scaphoid bone. The lunate is a semilunar bone that fit on distal radius. Here, the site of lunate bone. Distally from a scaphoid is trapezium. This is the distally, the trapezium bone. And the angular shape visible dorsally is triquetrum. Here, this is the triquetrum. And the square bone that bridges the proximal and the distal half of the wrist is pisiform. This is part of pisiform bone. The capitate is the round bone fitting inside the distal lunate, and distally here between the metacarpals can make out the hook of hamate. Oblique view. An oblique view is not routinely performed. It is, however, the only view showing the trapezoidal joint. Here, this is the joint that's shown by oblique view. Joint spaces, parallelism, and symmetry. The joint space of the wrist have width of 2 mm or less. Only the radiocarpal joint is slightly wider. The carpometacarpal joints are slightly narrower than the midcarpal joints. The carpolunate joint, هنا عندنا هذا الجوينت اللي هو بين الcapitate and lunate. The capitolunate joint is considered the baseline joint width to which other joint space can be compared. One should make sure to look at all of them: the radiocarpal, proximal intercarpal, the midcarpal, the distal intercarpal, and carpometacarpal joint space. Carpal joints should be symmetrical. Furthermore, when viewed in profile tangentially, the cortical margins of the bone constituting that joint should be parallel. Studying this parallelism is easier when regarding the carpal bones as pieces of jigsaw puzzle that all fit together, as opposed to tracing carpal bones by their outer cortical margins producing the outline. When one bone is not paralleling the other, that is out of place. If the rest of the bones still parallel each other, they have stayed together. This picture shows abnormal overlapping of lunate bone. This is the lunate bone. Abnormal overlapping of lunate bone with the bones capitate, hamate, and triquetrum. And also see the medial profile surface of a scaphoid. Here, the medial part of the scaphoid, but nothing paralleling it. There is also abnormal widening of radiolunate space. This is the space widening. The other joints are nicely parallel and symmetrical. This leads to conclusion that the lunate is displaced while the other bones have stayed together. Now the carpal arcs. The next step is looking at the three carpal arcs, اللي هي smooth curves joining the surface of carpal bones as shown on the right. This is the arcs. Start with the first arc is a smooth curve outlining the proximal convexities of scaphoid, lunate, and triquetrum. The second arc, this is the first. The second arc traces the distal concave surface of the same bones, and the third arc follow the main proximal curvature of the capitate and hamate. This is the third arc. Disruption of carpal arcs. An arc is disrupted if it cannot be traced smoothly. Break in one of the arcs indicate fracture or disruption of ligament leading to subluxation or dislocation. On the picture can note the disruption of arc 1 at the lunotriquetral joint. This is the joint, and we see the disruption at this point. Disruption of second carpal arc at the scapholunate joint and the lunotriquetral joint is seen below. Although there is gap in the first arc, it can still be traced by smooth curves, so arc 1 is considered intact. هنا arc 1 نقدر يعني نرسمه فهو still intact, but arc 2 اكو فد step بالscapholunate joint وبالlunotriquetral joint, فهنا اكو disruption. Disruption of third carpal arcs is shown in this picture. There is abnormal step off at the capitohamate joint. This is the step at the capitohamate joint. Now the shape of carpal bones. Start with the lunate shape. The lunate has trapezoidal shape as the sides converge from proximal surface to distal surface, which are grossly parallel. If the lunate is tilted, it becomes triangular in shape. Awareness of this fact prevents thinking the lunate might be dislocated based only on its appearance, that in fact change with its position, so it may be dislocated with tilting or just be tilted. Now بالPA view يكون trapezoidal و triangular تقريبا in shape when tilted. Lunate versus perilunate dislocation. Common dislocation of wrist are lunate and perilunate dislocation. The key to differentiate between both is what is centered over the radius. مثل هنا بدنا نشوف بالصورة اللي يفرق لنا what is centered over the radius. If the lunate centered over the radius and the capitate displaced, this is perilunate dislocation. Whether if the capitate is centered over the radius and the lunate displaced, this is called lunate dislocation. This picture showing the two types of dislocation. When lunate is displaced and the capitate is still in its place, this is lunate dislocation and give the sign that called spilled teacup sign. And perilunate dislocation, the capitate displaced dorsally and the lunate is still in its place over the distal radius. The scaphoid shape. The scaphoid shape changes with movement of the wrist. In ulnar deviation or extension, the scaphoid elongates to fill the space between the radial styloid and the base of the thumb, trapezium. Both with radial deviation as well as flexion of the wrist, the space between the radial styloid and trapezium is reduced. مثل ما نشوف هنا بالصورة من يصير flexion السبيس هنا راح يقل بين الترابيزيوم وبين الستايلويد. And the scaphoid fill this space, it will foreshorten until toward the palm. This will give the scaphoid signet ring appearance. This is the appearance of a scaphoid bone. Axis of carpal bones. Drawing the longitudinal axis of some of carpal bones on lateral radiograph and measuring the angle between them is good method of determining the wrist bones spatial relationship. The three most important axes are those through the scaphoid, lunate, and capitate as drawn on lateral radiograph. This is important axis through the scaphoid bone. Scaphoid axis, the true axis of scaphoid is line through the midpoint of its proximal and distal poles. Since the midpoint of proximal pole is often difficult to appreciate, and almost parallel line can be used that is traced along the most ventral points of proximal and distal poles of the bones. The lunate axis. The axis of lunate run through the midpoint of convex proximal and concave distal joint. This is the axis through the lunate bone, and can best be drawn by finding perpendicular to line joining the distal palmar and dorsal border of the bone. من خلال هاي الاكسس رح تتكون عندنا important angle اللي هي scapholunate angle. The normal value between 30 and 60, questionably abnormal between 60 and 80, and saying it is abnormal when it is more than 80. This indicates instability of the wrist. Capitate axis. The capitate axis join the mid portion of proximal convexity of the third metacarpal and that of proximal surface of capitate. This is the capitate axis, and the axis will give the angle capitolunate angle that is normally less than 30. When it is abnormal, it is more than 30 and indicates instability of wrist. Now, type of instability called dorsal intercalated segment instability or dorsiflexion instability is a form of instability involving the wrist. It occurs mainly after the disruption of scapholunate ligament and is more often encountered than volar intercalated segment instability. The causes of this instability: wrist trauma with or without a fracture, scaphoid fracture, that called bony dorsal instability, distal radial fracture, compensatory instability, and radius malunion, adaptive instability, and scapholunate ligament dissociation called ligamentous dorsal instability. On plain radiograph, on AP view, the normal trapezoidal configuration of scaphoid may be lost and it may appear triangular. On lateral radiograph, with the wrist in neutral position, the dorsal instability typically demonstrates dorsal tilt of the lunate with the both of the following: scapholunate angle more than 60, high sign of scapholunate ligament dissociation, and capitolunate angle more than 30. The capitate is displaced posteriorly compared to distal radius. As we seen here in this picture, this is the normal lateral sagittal view of the wrist point, wrist joint, and we see the lunate is in its place over the distal radius, and this is the capitate. This is the normal. And when compared with this dorsal instability, we see the displacement of the lunate bone and also the capitate. And also, as I said, there will be abnormalities in the angle. Here, the capitolunate angle is more than 30. This is the angle as the lunate displays, so the angle more than 30. And also the scapholunate angle more than 60. Here, this is the angle more than 60.
بس العفو دكتورة سارة، الأنجل شلون نقيسها؟ يعني
intercalated segment, volar intercalated segment instability. Volar intercalated segment instability is type of instability involving the wrist. It is less often encountered than dorsal intercalated segment instability. The pathology. This can occur because of disruption of radiocarpal ligaments on the ulnar side of the wrist. The main ligaments involved in this instability are thought to be the ulnar half of the volar arcuate ligament and the lunotriquetral ligament. On radiograph, abnormal carpal angles are seen on any lateral or sagittal imaging of the wrist when the wrist is in neutral position. The scapholunate angle هنا راح تصير less than 30 and the capitolunate angle more than 30. هنا مثل ما نشوف هاي الصورة من نرسم فد لاين اللي هو خلال ميد بوينت مال كل كاربال بونز حتى نحدد الانجل. هنا عندنا كابيتولونيت يعني اكسس خلال الكابيتيت بون ومن خلال الميد بوينت اوف لونيت، فهنا راح تطلع لنا مور ذان 30 اللي هي اب نورمال راح تكون لان عندنا النورمال ليس ذان 30، وهنا الاكسس اللي يمر خلال السكافويد midpoint of scaphoid and also midpoint of the lunate bone. فراح تطلع لنا الانجل less than 30. This is also abnormal لأن قلنا النورمال من 30 إلى 60. فهنا هاي الكيس هي polar intercalated segmental instability. This is the references and thank you.